Gunnar Esiason, and you are listening to Breathe In, a cystic fibrosis podcast presented by the Boomer Esiason Foundation and GunnarEsiason.com. This podcast series has been made possible by Vertex, Novartis, DCU, and Atlantic Health. The views expressed on Breathe In, a cystic fibrosis podcast are that of Gunnar Esiason, Lea and Tiffany Rich, and guests, and are not necessarily those of the Boomer Esiason Foundation. Nothing in this podcast series should be considered medical advice. Such advice can only be given by a physician who's experienced with cystic fibrosis. The Boomer Esiason Foundation, Gunnar Esiason, Lea and Tiffany Rich, and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to Breathe In, a cystic fibrosis podcast. All right, Gunnar Esiason back here for another episode of Breathe In, joined by my lovely host, as always, Lea and Tiffany Rich. How are you guys?
Good. How are you doing?
Pretty good.
Not bad, not bad. I'm actually in the midst of IV tune-up. I'm about 2 weeks in, which is lovely.
Yeah.
Got another week left. Always my favorite thing to do.
Yeah, I feel you.
But we can talk about that another time. Today we have a very cool episode on deck today. We're going to be talking about some questions that we've gotten in the DMs. As we've always said, the DMs are open.
Yes, and people were sliding in.
Read them all.
Yes, and
people were sliding in.
And to prove that the DMs are open, we're going to answer some questions in a mailbag type episode today.
Yeah.
So we're just going to go through a bunch. We'll see what we have time for today. We're going to bounce around from topic to topic, and then we'll see where this goes. And then maybe I think some of these topics can lead into other podcasts, specific podcast episodes about the questions at large. So here we go. Our first question is from Instagram. At Read a Lot of Books asks, what is our opinion about cystic fibrosis in literature or fiction? So the example that he used was the children's book, the new popular, I guess it's really a graphic novel called Ghost by Randy Telgemeier, and I actually just wrote a blog about that graphic novel. It's really, really good. In my opinion, I thought it was the most accurate representation of cystic fibrosis that I've seen in fiction and literature in really my time as a cystic fibrosis patient. Because I feel like we always see it. Like you see it in like Grey's Anatomy or Red Band Society, and it's all horrible.
It really is not even accurate.
And, well, if we talk about Red Band Society, the kid was smoking.
Yeah, it's horrible. It's horrible.
I'm like, no, that doesn't work. No.
And was having like a CF romance, and like, yes, there are a couple of those out there, but for the community at large, that's not really a thing.
It's not an accurate representation. I think people
and we don't live in a hospital.
Yeah, no, people are also no, you don't. And people are, I think, consumed with the. What the hell is the name of that movie that you guys love?
Fault in Our Stars.
Yeah, Fault in Our Stars.
Yeah. I never seen it, remember?
No,
I did not see it.
I love it. It makes me cry every time.
Oh
but like the representation of that character in that movie is not even accurate. Because there's this scene where she's like trying to walk up all the stairs in like the Anne Frank house, okay? And they claim this girl is like end stage lung cancer type of situation on oxygen, and she's like carrying her oxygen up like a couple flights of stairs and like ladders and stuff.
And I know that you can't do that.
Like she would have. She wouldn't even be able to walk into the building. But she could handle a 50-hour flight to Amsterdam.
In fairness, Hollywood is going to dramatize a lot of this stuff, just to make it like acceptable for the screen.
I just love pointing that out.
But I think it's all. I have yet to see a CF representation on screen, whether it's Red Band Society or something else that is actually good. I haven't seen that.
There's like a movie called Jack and Jill vs. the World. Have you ever seen that one?
I have not, no.
She has, it's Freddie Prinze Jr., and then the girl, Taryn or something, I forget her name, but she had cystic fibrosis. It's kind of weird. Because she would just be like, oh, I'm in for a tune-up. And then it would just be like her going to the hospital for like one scene, and then it would be done. It was weird. I don't know. It wasn't very accurate.
I feel like whenever you see the fictional representation of CF, whether it's Red Band Society or the weird Grey's Anatomy episode, like they hit the the prime CF lingo or vocabulary, just to be like, yeah,
Right.
we did our research. They used they talk about tune-ups and they talk about IVs and this and that and the other thing, but
Exactly.
like that's really as far as it goes. They don't really dive into the actual character of a person with CF. I mean, there isn't really a singular accurate representation of somebody with CF as far as I'm concerned, but I'm selling on this.
So
Other than Ghost, I haven't seen something that I've liked.
Yeah. So Bates
I agree.
Motel. Have you ever seen that?
No, I haven't seen that one.
I hated that show.
Okay, I never seen it,
only
but I
made it
know
through a
that the
couple episodes.
producer, someone on on the production side has CF, so they have a girl in there with CF.
Yeah, Lisa,
So
my sister, used to watch it, and
Okay.
she said that there was a girl with CF, but I just could not get into the show enough to watch it.
To watch it, yeah. I just didn't know if it was.
It's
accurate
all
or
very
anything.
it's all very subjective, right? I mean,
Yeah.
First you have to like the show. Like Red Band Society, the actual premise of the show is horrible. It was horrendous.
Yeah.
Oh, it was bad. Like,
I couldn't
it
even
was
make
hard for me to watch that
the
show.
pilot. The pilot was horrible.
Okay,
but
I watched it. I gave it a
too,
little
how they
bit of
portrayed it.
effort.
Oh god. Unfortunately, those are hours you're not going to get back in your life. Those are wasted
Probably not.
hours.
Really?
Those are absolutely wasted hours. That show sucked. Yeah, so I mean, what do we think about CF in literature and fiction? I think persons got to really do their research. And
Oh yeah.
as far as I'm concerned, the book Ghost, the graphic novel Ghost, and I've seen there are parents out there who have who take exception to the story Ghost because the kid with CF is actually very sick in the story. But I mean, you got to get over yourself. You get sick with CF, and that's the most accurate representation of it that I've seen in the fictional realm. So
I'll have to check it out.
Ghost is
We're
good.
gonna have to check it out.
It's a quick graphic novel read. Actually, Darcy, my girlfriend Darcy, she was the one that told me about it. I had no idea about it, and then she was the one who did it. So
Oh, okay, cool.
so that's that.
Sweet.
Okay.
All right, so on to the next topic. Let's go with this one. This was actually a pretty interesting question. This one also comes from Instagram. It's from @MissScarletRose. Do you follow the doctor's advice and or prescriptions exactly without deviation? And do we, give our opinions back to the doctors in place of that? Are we blindly following doctor's orders? What do you think about this one? This is actually an interesting question. I don't think I've ever really gotten this question before.
Yeah, I think it's good.
What do you guys think?
I can only talk about my personal experience, and I've talked about this a little bit on Instagram, especially a couple weeks ago, that my medication regimen is very different than most people with CF. I don't follow the 4-week course of most inhaled antibiotics or, the normal 2-week course of oral antibiotics. And the only way that we figured out what worked for me was because I deviated from the plan. And I don't recommend that to people. I mean, I really think it was a very open discussion I had with my doctor. And, we talked it out. And I was like, when I hit week 3, I start feeling like crap, and I feel like this infection's acting up. And he was like, it's okay if you want to play around with it a little bit because, for you, it might be a little bit different. So it definitely was a discussion where I have a very good relationship with my doctor. I'm very comfortable talking things out with him. And we usually work together as a team and kind of, bounce ideas back and forth off of each other because CF is different for each person. Mm-hmm. So, I have kind of played around with what works for me and it's worked out for me, but that doesn't necessarily mean that it would work out for anyone trying that situation. I do think you need to talk with your doctor about it.
I think so. I know before transplant, for antibiotics, I know orals never worked on me, and I would tell the doctor, you need to put me on IV antibiotics because that oral is not going to work. And I knew that because of my body, and I know how it reacts. And they would push oral antibiotics, but I would tell them no. I would like, no, that's not going to work. I'm just going to be back here in 2 weeks. So you just kind of know your body, and you kind of go with that and tell them, be your own advocate. And tell them, this is what's working for me, and I know that that's not going to work. So I feel like that in that case, if you know your body better than the doctors, just talk to them. Don't do it without telling them. Yeah.
Yeah. You guys are both talking about being an empowered patient, and I think that's really what it comes down to, whether or not you can be an empowered patient. And Some people have the ability to do that, like they have an inherent ability to talk back to their doctor, which I think is a very healthy thing. And other people don't have that ability. So, you know, people are just either, I want to say they're, you know, they're nervous about it, or they just, you know, they don't know what they're talking about. But ultimately what it comes down to is really looking into and reading into what you're taking and why you're taking stuff, right?
Yes.
And, you know, you got to understand what every single medication is doing for you. They all serve a different purpose. You just have to know what they're there to do.
Right.
And I do think, you know, as far as following a doctor's orders specifically, yeah, I mean, if a doctor tells me to do something, I'm almost absolutely certainly going to do it. Because, you know, that person has spent, you know, decades studying cystic fibrosis and the evolution of cystic fibrosis, and that person knows exactly what's going on. I like to say that I provide feedback to the doctor.
Yeah.
Right?
Totally.
You know, I know, like you girls, you know, you guys know what works and what doesn't work with antibiotic regimens and things of that nature. But at the same time, I wouldn't start self-medicating myself with some crazy supplement. That is like an idiot. That is not what we are endorsing here. We are endorsing talking about basically expanding your treatment regimen to include conversation with the doctor and with the care team so that you may best benefit from what is being prescribed to you.
Exactly. Kind of like an example is when I was going through my really 6 stages, Lea and I would talk, and the albuterol that I was taking was making my heart race a lot, and I couldn't really handle a treatment anymore. So she kind of said, well, maybe you should ask about the Zopanex or whatever. And that's how I went to my doctor and asked them about that, and we kind of figured out a regimen. You know, that's how I got into that, so I could
I don't think it hurts to, you know, talk with other CFers and kind of see what works for them. And, you know, that might work for you, but I also think there's a lot of things out there that talk about natural remedies and people inhaling different types of things that aren't necessarily prescribed to them.
People inhaling other things is like the most insane thing
I can't really wrap my mind around that. You know,
me neither.
I've definitely researched some of them because, you know, it's interesting to read about. But even in those situations, I'll like talk to my doctor, not because I necessarily want to try it, but I'm just kind of curious, you know? And I think like if you're someone that sees those types of things online and you're like, oh, maybe I want to try that with my regimen, I think that is one thing you should 100% talk to your doctor about before you even attempt that.
Yeah. Oh my God.
You know, because that could be very, very, very self-harming.
I mean, the thing that I, like most recently, the medication that I get, I don't even know whether it's really a medication or not, is the NAC, the N-acetylcysteine. And that is something that's been used in cystic fibrosis for years. It's been used worldwide for years. In fact, it's proven to be effective in pulmonary fibrosis. It's it's been studied in cystic fibrosis, and there has been shown to see FEV1 improvement, but it's shown to sort of be an anti-inflammatory. And whether or not that's something that benefits a lot of people or not, I don't know. But you know, it's something that they do use in different parts of the world in cystic fibrosis, and some doctors still are very aggressive with the NAC. And the brand name is Mucomist. And we can get over here. We can get it over the counter in the United States. And I was talking to a number of patients. A lot of them use it. A lot of international patients use it. And it's actually in, you know, I get it from Canada, and I asked my doctor about it. I was like, you know, what about this NAC stuff? Is this something that I should look into? And she's like, you know, if you want to take it, go for it. You know, it's something that obviously people with CF are using. You know, it's something that's worked for me, and I take NAC daily now, and you know, who knows? Maybe it is helping with inflammation, maybe it's not. I don't know, but I like it, and that's something that I brought up with my doctor. We discussed the pros and cons, and then now
I also think, like, if it gives you a better quality of life, it might not, you know, make your numbers go up or something like that, but if you feel a little bit better from that, it's not a bad thing to add in.
It's also, you know, it's generally considered safe or whatever by the FDA. Right, you know, so.
But it's definitely something you should talk out.
They used to give me that in the hospital before.
Oh, really? Yeah.
Yeah,
I've never had it.
Yeah.
It's kind of like people used to take it a lot before Pulmozyme because it sort of like reduces inflammation in the chest or whatever. Pulmozyme, some people feel that Pulmozyme has sort of pushed it out, but you know, who knows? I actually don't inhale it. I drink it. I drink the NAC.
Oh, you drink it. See, it smells really bad when you inhale it. It's like sulfur.
Yeah. I know. All right,
so it's gross.
Let's move on to the next question here.
Okay.
This one comes from Instagram as well, at Little Larch. Have we felt anger or anything towards our parents because of the genetic code that has been passed on to us? So, do we hold our parents accountable for giving us CF?
No,
I do not hold my parents accountable for giving me
CF. No, definitely not.
Yeah, I mean, I feel like that's a pretty easy one to answer. Like, no, really, it happens, you know? Everyone's life is going to have some type of hardship, and it's going to break away from the norm at some point.
Exactly.
Ours just happened a lot sooner.
This is the hand we were dealt.
Of that. Right.
Yeah, we make the most of it, and no, it's not our parents' fault at all.
I'm pissed that I don't have blue eyes.
I know. I was really hoping I'd be a blonde.
We can go back and look at like specific parts of our genetic, outcome. I'm pretty happy that I'm 6'3". That's a cool one.
That's a nice perk for being a guy.
Yeah, not so happy I don't have blue eyes. I mean, like you get what you get, right? That's kind of
exactly. Right.
But no, I do not feel any hate or anger towards my parents for giving me CF.
No, definitely not.
That's actually a pretty common question, but
It's actually a really good question too.
It is a very good question.
I think if I were a parent in that situation, I'd wonder.
Yeah.
Yeah.
They think about it, and they probably feel some remorse, and I
think it's similar to how we've talked about how we feel guilt when we ask other people to do things or have to accommodate our life a little bit. I think a lot of times our parents feel guilt that they even put that on us, and
probably
they shouldn't feel guilty.
They shouldn't.
That's
life.
That's a no. All right, so here's one. This one comes from at HoboSpice9 on Instagram. Do you have any tips for flying?
Oh yes, I love my seat covers. Yeah. I get them. They're just disposable seat covers. They're great. Clorox wipes.
Yeah, Clorox wipes.
And a mask, of course.
Yeah, any type of mask. I think those
honestly. And when you use the Clorox wipes, wipe like everything down. Even wipe down the seatbelt.
Yeah. Oh, the seatbelt's the big one. What I use, I go in there. I have like the little routine, right? I wipe down the tray table. Yes. I wipe down the armrests. I wipe down the seatbelt. And then, sometimes I'll wipe down the actual seat itself. But basically, anything I'm going to be touching with my hands is something I'm going to wipe down. Especially on the commuter jets. The jets, they just turn around. If you're flying a more of a longer distance or whatever, they maintain them as far as the cleanliness, to a higher standard. But the commuter jets, the ones that if you're flying from like New York to Boston or Boston to DC or whatever, those are those are planes that they turn around really quickly and they don't give a good thorough cleaning. So those are the ones that I'm more anal about when it comes to wiping stuff down.
And
also
then
the mask.
If you have a window seat, I always wipe down the window area, like the walls. And stuff. Yeah, I think that's like the best.
I'm an aisle seat person. I like I got
because you're tall.
Yeah,
it's because you're tall. You need that room. Do you guys do anything? The air thing. The air. That thing. I always turn it off because it's circulated air.
Oh, really?
Yeah.
Yeah,
I keep that thing blasting on me. I'm like, give me the air.
Oh,
give it
and
to
you're
me.
Like getting all the germs.
So you're getting all the germs on you.
Yeah, I turn it
off.
So
nasty.
But it's so hot.
Or I blow it on the person in front of me.
Just bring like one of those portable fans that you can put on your phone.
That's what I'm going to get you for your birthday.
Thank you. Yeah. Thank you. The big thing with flying that we haven't talked about is the letter of medical need. That's the thing that you really need.
So that you need that.
So that you can carry everything on and you can get it through TSA. I mean, that's the big thing. You get it from your social worker, a list of medications, list of devices, a phone number for TSA or the airline to call.
If there's like an emergency.
That's the big one. Or I'm really saying if there's an argument.
Yeah, no, that too.
But
I honestly
add that too.
Have never had to show that to anyone.
I haven't either.
Yeah,
but
you're not.
Yeah,
I haven't either. But I think
you're not supposed to have to.
Exactly.
Or whatever.
But I do always have one.
So do I. I do think. Yeah. In talking with other families with CF and stuff like that, it seems that the families traveling seem to have more of a difficulty with this, right? If there's like a family with like 5 kids and one kid has CF. For some reason, that kind of family runs into issues, and the reason I think that happens is because I think people. I'm not saying people in the CF community do, but people out there do definitely abuse the system, right?
I agree.
The system is there to help us. we're not there to take, not there to game the system. We have to utilize the system that's at our power to really make sure that we're getting what we get. But I do think there are people out there, whether or not they have CF or they, dealing with something else, that abuse the system and use it just for convenience.
Yeah.
We're using it. We're using it because we have to. We use it because we're getting on the airplane first, because we have to put all the bags away. We have to, make sure we're getting down the aisle.
By the time I do all that, I'm suffocating, and then you put me all the way up in the air, and I just pass out.
Yeah. So, I mean, that's, those are the things the big things from traveling are obviously making sure it's clean. Yeah, pre-boarding, the letter of medical need, carry everything on, and the mask.
Never check your meds. Never check those.
Sometimes they'll
always keep them with you.
Yeah, sometimes they'll force you to kind of like do something a little unusual, but you just got to be stern with them. You got to be like, no, I'm not.
Yep.
I'm not doing that. And then I love to be like, do you know how much this vest costs? You're not like.
Oh my God, I do that all the time.
Like, I'm not. You are not touching this thing. Like, I will put it away. That's not. That is not your responsibility. It is my responsibility to make sure that this thing gets from A to B under my possession. Yeah. So that's the other one. Yeah, don't give anyone control of the vest ever.
No.
Ever. All right, so that's a good question. That answers that one. All right, this one's for you two girls because I don't really qualify for this one. How many PICC lines did you guys have before you had a port inserted? How many PICC lines did you have before a port?
I don't think either of us really know the answer to this question.
Because it's a lot. I had a lot.
It was a significant amount. I'm going to guess. Hold on. I'm going to do a real quick count.
I know. I have
see some of the scars still, because when they put them in when I was little, they didn't really know what they were doing.
Well, I had PICC and midlines too. So I have
the midline. The midline is like the JV version of the PICC line.
Yeah, it's smaller. It only goes to your arm length or whatever. I don't know. I have a whole bunch of scars, so I'm just gonna say I have no idea, but it was a lot.
I'm gonna go with between 15 and 20.
Wow.
Okay, I think mine might be a little bit more than that because
you probably were.
Most likely.
You were.
And then they tried to put a few in after transplant too, and did not work. So, bedside. Remember we were talking about bedside?
The bedside PICC line is like the dumbest thing ever. Just get interventional radiology.
It doesn't work for me.
It's not going to happen.
Yeah.
The bedside, bedside PICC line is like the lazy way of doing it.
Yeah.
Yeah, I would never subject myself to such a horrible thing.
I tried it twice, and it was the most traumatic experience of my life.
It's horrendous.
Yeah,
horrendous. And I had the central lines after transplant, like 5.
Yeah.
But I've had so many PICCs and midlines that I think I lost count.
Yeah,
and then ports came into play.
I'm in the 20 neighborhood myself. I am definitely up in that. I'm definitely up in the 20s, I think. But I don't have a port because I am on Team PICC line.
You're not.
I am on Team PICC line.
You need to get one, and you're cool with getting stuck. Hey, it's your choice, but I'm just saying, one day when you decide to get a port, which you probably will decide to, you will be like, why didn't I do this sooner? You guys were right. You're welcome.
I had my port flushed yesterday. It did not hurt or anything, so...
Oh my God. Okay.
I did mine last week.
All right, next question. Next question comes from @Haley20 on Instagram. She wants to know, how old were you for your first hospital stay, or when was your first hospital stay?
Well, other than when I was born?
Yes.
Oh. I was probably a few months after that, I would think. I've been in the hospital all my life.
What is the first time that you have a real conscious memory of being in the hospital?
When I was 7 or 8. Okay. Something like that. Yeah.
Mine was a little bit later. My first time I was ever in the hospital was, I think, 7th grade. 6th or 7th grade. And then I really didn't end up in the hospital again until either once in high school or it was after high school before college.
Okay. So was it when you did your port or right before your port?
No, even when I got my port, we did it all outpatient. Okay. And every time I had a bronch, we did it outpatient. Every time I had a PICC, we did that outpatient. Mm-hmm. The only times I was really ever hospitalized were if I coughed up an extreme amount of blood. So the time I was in 6th or 7th grade, that's the first time I had a significant amount of hemoptysis.
Yeah, that's when I had my embolization, was when I was 12.
Wow. You were that little?
Yeah.
Oh.
Yeah.
I didn't have mine until, I think, my freshman year of college was my first one.
Oh, really?
Exciting news, everyone. This is kind of off topic, but I was really excited last week when I found this out. So, you all know I've had a million embolizations, and we get a lot of feedback on that. A lot of people don't understand how I've had 9, but I have. I met someone who has had 38.
Oh,
wow. 38 embolizations.
Yes.
Wow.
That's a lot.
Holy
damn
crap.
So, if I need them, I can keep going.
You're not the leader in the clubhouse anymore. My first hospitalization was, other than when I was diagnosed, it was when I was 19. I was a sophomore in college. I did everything outpatient growing up. I did, outpatient PICC lines. I did outpatient.
Yeah, that's how it was for me too.
I would do bronchoscopies. I'd do it same day outpatient. There was one time when I had like a longer than usual recovery after a bronchoscopy when I was little, and they thought I was going to have to stay inpatient, but I didn't. I was able to go home.
Oh, okay.
I might have had one like that. I think I was inpatient one time after a bronch because it didn't go well.
So yeah, sometimes the recovery is just a little longer than normal.
Yeah, it's usually for like a day or two, and then you're back.
Yeah. I mean, I
have a question. This kind of goes along with this. When was the first time you ever had IV antibiotics?
Mine was in first grade.
Mine was 2nd grade.
Yeah, first grade for me.
It had to be when I was 5 or something.
I think I may have done it when I was diagnosed. I think when I was, because I was diagnosed late. I was diagnosed at age 2. So I think for me it might have been around then. But
your first memory.
My first memory of it was first grade, and then I would do it every 2 or 3 years. I used to hate it. I used to scry.
I did too. I'm pretty sure I did it every other year for a couple years, and then it became every year. Yeah. Then it became every 6 months, and
Yeah, I think
the window between them just gets shorter and shorter.
Yeah, and
I
then
remember
15 PICC lines.
Yeah.
I had a few years that I didn't have to do antibiotics, which were amazing.
That's awesome.
But that was in elementary school, and then I feel like when I hit middle school, then it just became the norm to go in, and I don't remember when we started doing home IVs. I know I always went in for a few days inpatient, and then I would go home. But I think we started doing that probably when I was 13 or something, going into high school and doing all that. So I think that's when we started doing it. I used to do the full 2 weeks in the hospital.
Mm-hmm.
Oh, that's rough.
That sucks. That's horrendous. I always see kids doing that, and I'm like, that sucks. That's horrendous.
Some centers don't believe in doing home IVs, I guess.
That's the biggest load of crap I've ever heard, because I
think it's more risky to be in the hospital.
Oh my god,
it is.
It's a lot more risky to be in the hospital.
Is.
You also can't get better. You're sitting in a room all day.
Exactly.
Right.
And that's why...
I mean, I understand that not everyone is responsible enough to be doing IVs. And then
I think there's a couple things that come into play with this.
Different things
I think it depends on the doctor. I think it depends on what the parents are capable of being able to balance, which, I mean, everyone has lives. They have jobs. They have other kids. They might not be able to make it work. And then also insurance. I mean, some people's insurance
is also the other part
will cover it in the hospital, but they won't cover it at home. And it's unfortunate that a lot of times health gets dictated by that.
It's stupid, though, because it should be cheaper for home care. Home care should be...
Oh, definitely.
It should, and it just blows my mind that they'd rather have you in the hospital where you're not going to get, I don't know. I don't get better there, but that's just me.
The law is written.
Yeah.
It's idiotic. All right, so we'll move on from that. Okay, let's see, where are we? Okay, this one comes from someone studying to be a teacher in grad school. And at MaceJM9 from Instagram wants to know some of the things that teachers did that were great. What do we wish teachers did? And how do we think it's best for teachers to support someone with CF, or someone with special needs in school?
Yeah. I think giving extra time when we're not feeling good for certain assignments and tests, I think that's really helped a lot. and especially for eating in class. I think that was really nice.
Yeah,
That
I
was
think
like
eating and going to the bathroom during class were
Yes.
big ones when I was younger because
Yeah.
it wasn't really a thing they would let you do. I remember in nursing school, it's kind of interesting that you couldn't have a bottle of water with you
Yeah.
when you were in certain like class situations or if you were taking a test. You were not allowed to have a bottle of water, probably for cheating purposes.
Yep.
But
Yeah.
I was in a situation where, I mean, if I was sitting down to take a 2 to 3 hour exam, I couldn't go the whole time without a drink of water or not being able to go to the bathroom. So that was one of
I
those
had that too.
situations where you have to sit down with your dean of students or someone that can make those accommodations and, you know, be able to have a drink, go to the bathroom. Honestly, sometimes you might need extra time because if you're having to drink, go to the bathroom, and you're coughing up a lung, I mean, that does take away from your focus in a sense,
definitely.
you know?
And
So I think those helped a lot, especially later in life.
For like grade school, meeting with the parents and the student is really important to get all the information you can. And I know we always gave a flyer from the for CF about the disease and stuff. So I think that helps too, just to kind of educate them on what your child is going through.
I think, looking back at, the younger years, the earlier years of schooling, those are the big ones, right? Like making sure the teacher was on the same page as the parents.
Right. And
I loved teachers and coaches when I was younger that knew how far to push me. They weren't gonna like make CF the big thing in my life. They just knew how far to push me based on my health, and they would find ways to push me even further each time. I'd go for a workout with a coach or in school.
Yeah.
They didn't treat me any differently than other kids simply because I had CF. That I was held to the same expectations as everyone else.
Yeah.
But ultimately, what it came down to was whether or not I could, my health was stable enough to do something. And a lot of times it was, and teachers treated me like everyone else. And that, I think, was the big thing, to treat me like everyone else. I look back at, certain teachers that, I would have IVs. I would go to school with IVs, and my mom or whatever, when they take lunch or whatever, would come and meet me, and that's how we do my midday infusion. Or we would just time around the school day. Somehow we'd work with the doctor about choosing antibiotics and things like that of that nature. Yeah. And the school was very willing to work with me. I was able to carry my pills with me. I didn't have to go to the nurse.
Yes.
You don't want to basically add hurdles to the student's day because that's how it'll suck.
I don't think you also want to like single them out and make them feel different, especially because when you're going through those developmental time periods, I don't think that's important, like I think you need to learn how to like grow into yourself and who you are, and CF is going to play a little bit of a role in that, but I don't know. I think certain situations, like having to go to the nurse to take your pills, or, I think in other situations there are people that kind of baby you in a sense where they're like, oh, well, are you sure you can handle this? Like, I know myself best, even at the age of 6 or 7, like, right. You have to be there and be receptive to if they're having a rough day. Maybe they have to come in an hour later or something like that. Or if they're going through IVs, you might have to accommodate that they might have to leave the class for 45 minutes to go do that. But I think it's important to still keep them on a routine and, make them feel like they're just like their peers,
Oh, definitely.
Exactly.
Yeah.
All right. So, I mean, that's going to answer that question. I think let's move on to the next one here. This one's actually pretty funny. This one's from a new mom asking about her newly diagnosed kid with CF, and the mom wants to know if our social lives have been impacted by being sick, if partying has been influenced by us having to do treatments, how do we manage our treatments if we're going out partying. I love the parents that ask questions that like a kid is not going to have to experience for like 20 years. Right?
They might
like this is like for all I know, we're talking about this is like the mother of like a newborn who just got diagnosed with CF.
Yeah.
And she wants to know if her kid can go out and drink Bud Lights with some friends when he's 20 years old. I think the forward-looking questions are always really funny. Let's put it this way. I told a story a few days ago about using a G-tube, a few podcasts ago about using my G-tube to funnel beers. That's, I think I think there's definitely room to go out and have a good time.
Exactly.
In spite of CF.
I agree.
Definitely.
I think what I did, during my years where I went out a lot, I don't really do that as much anymore. I have a social life, but it's a little different. Yeah, what I used to do, though, was a lot of times I would plan my night out around my treatments, in a sense, but I'd also make sure I could accomplish majority of the night with my peers. So that usually meant that maybe I skipped dinner with everyone, and I did my treatments during dinner. You know what I mean? That way, if we were going out and we were going to go to a pregame, and then we were going to go to a bar, or we were going to drink somewhere, I didn't have to worry about, Lea might be drunk. Is she going to do her treatment? You know what I mean? Sometimes that's hard. You might not end up back where you're able to do your treatments, So a lot of times I would plan ahead in those situations.
Putting the vest on after 13 Bud Lights, not fun.
Probably not a good idea.
That is not a good thing.
Yeah, I know my friends always had my back after we were out for a night of drinking. They would be like, Tiffany, did you do your treatment? Did you do your treatment? Tiffany, let's do your treatment right now. And they would get it out and start mixing my med for me.
Oh my
and
God.
They would make sure that I was set and I ate. They're like, you need to eat. We need to get your calories up.
It's funny,
and
as soon as alcohol becomes involved, everyone becomes like the mega nurse, right?
Yeah.
All of a sudden becomes very involved in
Totally.
your health. It's like all of a sudden it just amplifies for every single person around you. I mean, I think there's days when we were in college where we'd go somewhere and of course some asshole would light up a cigarette or something inside, and next thing you know, my friends would act like the fire department. It'd be like they'd stop, drop, and roll, Gunnar, or we'd have to get out of the house, or they'd throw that person out or something. It's funny how stuff like that happens. But yeah, I mean the big thing that I always did, and to the mother who asked this question, your kid's gonna run into this in 20 years. I made sure that I did my treatments before anything ever happened. Right?
That was how I was most successful.
But it's also,
but I learned that from growing up too, right? If my parents ever want to take us out to dinner with family friends, or we're going out to celebrate a birthday party or something like that, I would always do treatments before we'd ever go anywhere or do anything. Because you're gonna get back, it's gonna be late, and the kid's not gonna want to do treatments at midnight. So that's a skill or a habit that I learned early on.
Yeah, I agree.
Yeah, I think it plays a role in your care even when you're not out partying.
Yeah,
You just got to learn how to plan out your day so that you
can management,
be successful in your treatments and your care, but you also can live your life and have fun and do things that your friends are doing.
It's just a balance. You just
gotta you find places to do treatments, places to do nebs, how to travel with your nebs. That's something that comes with time, and it may seem daunting now, but it's something that everyone figures out, because let's put it this way. If you really want to do something in life, you're going to figure out how to do it, right? You're going to figure out how to manage your treatments and your time and all that stuff that goes into it to figure out a way to do that.
I found a way to meet Taylor Swift, so.
Right, it always ties into that.
It always goes back.
I'll keep you updated when I find a way to meet a sloth.
Okay, so we're gonna the last two questions we'll combine into one. The first part of this question is, how do I get my 10-year-old daughter to take her treatments more seriously, and how can she stay healthy? It's been a while since she's been sick. I feel like that hasn't been a motivating factor. That comes from @cneil77 on Instagram. And then this other one came to me on Facebook, the Facebook DMs. And this one asks, when did you take over your personal care? And did you ever ignore that responsibility? Was there a power struggle with your parents? So I think these two are kind of related in the sense that we're talking about getting older and as care evolves as we get older, right? So for little kids, it's obviously going to be difficult. But I'm a big believer in, the iron fist when you're a kid. You have to discipline your kid. You have to have a very short leash with the treatments. I mean, that's something that has to be ingrained from day one. You have to do these, right?
Well, the only way you can ingrain that is by sitting your kid down, giving them no real option, and saying, "This is what you have to do."
Yeah, and
and you're not going to go have fun. You can't go outside.
That's what my parents did.
This is done.
Every day in the morning and at night. And I did not have a lung infection or breathing issues until I was a little bit older. So, I mean, that really didn't hit until middle school. So I didn't really know what it felt like, but I know that I had no other option, or I was
Yeah,
not going to be able to do what I wanted that day.
You got to be hard with the kids on that, and
Yeah.
you can't be afraid to like weaponize things, right? You can for example, you can weaponize Christmas. Santa Claus is going to see if you're not doing your treatments, and you're going to end up on the naughty list, right? That's when you're weaponize the video games. You can't play your Xbox unless you're doing your treatments, or maybe you can only play your Xbox when you're doing your treatments. Like those,
exactly.
You have to motivate kids at different ages to do it, and you have to be hard on it. You have to be hard.
You do, and I think my parents would, occasionally bribe me if I was going through a really, really rough time period where I really didn't want to do those things, and I don't always agree with that because I don't think you want to make your kid entitled, because I think that could easily do that.
Yeah,
but I think occasionally it is. I think occasionally bribing is not a bad way to go. It just should not be a regular
when the time is appropriate. Yeah,
exactly.
Yeah, exactly.
Yeah,
I always was in charge of my meds. In a way, they kind of made me more independent because both my parents worked. So I would have to go to daycare. And I knew that I had to do those treatments. I needed to do those. Yeah, and I was young, and I learned how to do every single thing because my parents said, you got to be independent because we're not going to be there all the time.
Right.
And you're with a daycare aide, whatever, and she knew of my CF. She was taught all about it, but ultimately it was me that needed to sit there and do it.
Yeah. So, I mean, I think is Zoe trying to make a guest appearance here? No, I think That's actually interesting. I've never really heard about that from a young age, from like someone being so empowered to do it themselves, because that kind of goes to our other question. What age did you really take over the care, and did you have a power struggle with your parents?
So Tiffany's was when she was about 5.
Yeah, Tiffany was a child. Tiffany was a child prodigy,
very
doing her own treatments. For me, it was as I was in high school. That's when I started to, start to take things over step by step. Like I would, the first step was, learning each individual medication and what they did. And then the next, was how to, build them, and how to, the medications that you had to reconstitute, like colistin, for example. I had to learn how to reconstitute it with a syringe and stuff like that.
Yeah, too.
And then, the step after that, the last step before college was learning how to sterilize my nebs. My for whatever reason, my parents would not let me boil the water or sterilize the nebs until they felt that I was appropriately of age. And then I think by the time I was also in college was when I my parents let me get the PICC line extender tube so that I could do it with myself. They wouldn't let me have that when I was younger. Like, I wasn't allowed to do that when I was younger.
Yeah, I feel like mine was similar to yours. Like, high school was probably learning the medications more in depth.
Yeah, I mean, I knew what everything did before that.
Certain order, because I do think you have some type of knowledge of that even prior to those ages. But it was a lot more learning how to manage my personal care when it came to the nebs and the vest, and and even IVs. I remember IVs were a big deal because my parents always kind of balanced what they would help with. So a lot of times my dad would be in charge of IVs. Like that was his thing. Yeah. I think he would have thrived being a nurse, to be honest. He loved it. That was one of our biggest struggles was having my dad give up doing the IVs. I'd be like, no, I was very anal about it and I wanted it done a certain way. And, when I hit that point where I was comfortable doing it myself, I remember that being a big power struggle. We had a hard time cutting the cord with that one. There was just certain things like that it took time.
The big power struggle for me was going to the appointments by myself. Going to the doctors by myself. When I was younger, my mom was always the one that took me. My dad would occasionally come feel for the big ones or whatever. But by the time I got to adult care, it was the very first thing my doctor said to me, because my parents brought me to the adult care, the adult CF appointment, and the first thing that happened was my parents got thrown out of the room, and I was just me and the doctor in the room.
Yeah.
And obviously that's a big show, that the doctors always do, but the doctor said to me, Gunnar, you can come to these things by yourself. And it took me probably 6 months or so to really do that, and then as soon as I started going by myself, I was like, oh, this is I can go on my own schedule. I can do this, that,
Right.
It's not that big of a deal. There are kids out there who see it that start going to appointments earlier. And looking back, I kind of wish that I would have driven myself to my appointments when I was in high school, because that's how you start to really manage to care yourself. Because you're going to get news from the doctor, good or bad news, and you have to learn how to digest that news yourself. And I think going to the doctor yourself definitely promotes that. I mean, I always call my mom or dad as soon as I leave the doctor, but there is still a point in time, as soon as I, from walking to the doctor's office to either the X-ray or to the car or whatever, where I'm digesting whatever I just heard and learned by myself. And that's that's something that you have to learn how to do.
You do.
That's it.
I think
I always call it cutting out the middleman. Like, you're cutting out your parents. You're cutting your parents out of the
I think it's a hard transition, especially when you go from peds to adults, and your parents aren't allowed anymore to call when you're sick. Okay, I remember that being a very big deal. Where I was so used to, if I didn't feel well, my parents would call the doctor. They get it situated. They get my antibiotic. They get it all under control. And that was one of the first things I had to learn how to do when I moved into the adult clinic, because my pediatric clinic didn't really promote that. They weren't like, Leah, you should really start doing this. It was kind of like, I got to adult, they wouldn't talk to my parents because they didn't have verification they could talk to them. And that was up to me. And I remember that was very hard on my parents too, because it might have actually been harder on my parents than it was on me, because I was like, okay, like, once you develop a relationship with people, it's really not a hard thing to do. But, they wanted to help me. They wanted to be able to figure out ways to help me.
Every CF parent wants to micromanage their kid. That's what it comes down to.
And it was very hard. I mean, we have went through, I feel like, stages throughout the course of my life where it's like, all right, they let go of this aspect of helping me, and I take that on. You know what I mean? It wasn't really everything hit me at once, and I had to do everything on my own at once. You know, it was like gradual baby steps. I kind of feel. I think. I thought it was a good transition, but it was definitely hard. I'd have to speak up and be like, Mom and Dad, I'm ready to take over this. Like, I do not want you doing this. And it was so hard for them to give up those things, because they only want the best for me. They only want to help me.
I know that, like, when I was in high school, my mom would always take me to the doctor, to clinic. And then when I got into college, I started taking myself. Then when I got sicker, I would always want someone with me, because I felt like after I did all the PFTs and then I was doing the evaluation for a transplant and all that stuff, I would be exhausted walking that 6-minute walk, doing, my PFT and all that fun stuff. I felt exhausted, and I didn't think I could drive myself, honestly. But I feel like when I got bad news, like when I got told that I needed a transplant, I was by myself, and I think I wish I had someone there, but like you said, Gunnar, you digest it, and then you kind of understand, like, okay, so why is this happening, and how can I kind of tell my peers and my family about this big deal that's happening that's not so ideal, but it's something that is good to go take yourself. But then when you get into the cases of not feeling well, then yes, of course, like, what you're comfortable with.
I mean, I'm not going to sit here and say that, like, if I have pneumonia or whatever, I'm driving myself. My mom's still definitely driving me if I am feeling very, very sick.
You're not capable of just driving yourself at that point.
I mean, you got to get, however you got to get there, you got to get there. But, I think I do think that parents, in a lot of cases, are unwilling to just let go of the reins so easily, because it's hard. It's such a big part of their lives too.
It is,
and that's
we are their lives.
That's kind of where I think that's kind of where the struggle exists.
It is.
But
that's one of the only things I still like. My dad, he stopped coming to appointments pretty early on. He was with me probably all the way through high school, and then once I got to college, that was one of the things that I kind of phased him out of. But like, my mom, for the most part, she comes with me to majority of them, and it's more of like
I think it's
a way for us to just hang out. You know what I mean? As weird as that sounds, like, I do appreciate having someone there. And, you know, if I get difficult information, it is nice to have her there and kind of talk it out because, you know, I have had kind of some rough times over the past couple of years and making the right decision. You know, I get a lot of anxiety about it. But, I mean, it's more of one of those situations where we turn it into a positive experience and she really just comes so we can, like, spend time together and talk, you know, and then we usually go to dinner after.
Yeah.
But, I mean, you know, like, because I don't see her a whole lot. I live with her and I don't even see her, you know?
Right. No, it's true. Like, after my Stanford appointments, there's the nice mall. So me and my mom go to eat and go shopping. And it's kind of like a nice bonding time in a way, you know?
Yeah. But I also don't have a problem going by myself.
Exactly.
I remember my first couple appointments doing that, you know, and I love my team and I like love going to see them, which is bizarre to say, you know, but
you know, I think
really enjoy seeing them.
That's something that happens to a lot of patients. Is I think a lot of patients do find comfort in seeing their medical teams, and I mean, I'm definitely one of those people because I know that, you know, it's a very active way of managing your health, you know, that's a good way of doing it. All right, so we're way over the time here, so we have to we have to wrap this up.
Okay.
All right, so this has been a cool mailbag episode. We'll come back to this again. There were a few topics that we didn't get to, but those are also topics that I think we can dedicate full episodes
podcast.
to.
Yes.
So in doing so, we'll get back to that. Just know that we have seen your questions, everyone. We have seen your questions, but we'll get back to them in future episodes here. And I think it's pretty much it. Remember, the DMs are open, as evidenced by this episode. The DMs are open at breathe_in_pod on Instagram.
Woo!
They're the Salty Sisters on Instagram and Facebook. I'm Gunnar Esiason. You can get them at saltysisters@gmail.com. Make sure to check out their Etsy store. That's where the Breathe In t-shirt is. One of these days, we'll wear the Breathe In t-shirt on the show. One of these days.
Next week.
When it's consistently warm. Because it's a short sleeve t-shirt. When it's consistently warm, we'll wear it.
Okay. Yeah.
And then my email's gunnarsblog@esiason.org. Or you can just hit me up on whatever social media, I guess. And I think that's it. Do you guys have anything else to say? Or
no, but thank you all for listening to my really raspy voice.
Yes, Lea, hopefully you feel better. Hopefully you feel better.
I'm working on it.
Feel better. And thanks for all the questions.
Yes, this has been a good episode. All right, guys. Well, thanks everyone, and we will see you next week.
Yeah.
Bye.
Bye.